Hello, my name is Khan Phan, and I'm a pharmacy student from California Northstate University, College of Pharmacy, class of 2022. Today I will be talking about Lovaza, also known as omega-3 acid ethyl esters, or fish oils. Lovaza is commonly used to treat high triglycerides in combination with a healthy diet and exercise in adults with levels above 500 milligrams per deciliter. For administration, the patient is to take 4 capsules by mouth once daily, or they can separate it into 2 times a day, 2 capsules in the morning, and then 2 capsules at night with a meal. Lovaza is derived from fish oils, so for patients who are allergic to shellfish or fish in general, there could be a potential allergy to the medication. It may also cause taste perversion. The patient may taste a fishy taste in their mouth after taking the medication. Patient is to still maintain a healthy lifestyle while taking this medication for added benefits. And lastly, the patient should not chew or break the capsules. Some precautions that the patient should take include the cardiovascular component, which is atrial fibrillation or flutter. When the patient has a history of atrial fibrillation and taking Lovaza, the patient may experience worsening symptoms of atrial fibrillation or flutter. Also, the LDL cholesterol, which are the bad cholesterols, may increase while taking this medication. Also, their liver enzymes, the AST and ALT levels may increase, and the patient may be allergic to the fish component of the medication. Some common side effects to this medication is burping, indigestion, and the taste may be altered. And the serious reaction is the allergic reaction to the medication. Some more background about the disease of hypertriglyceridemia is that it is a common abnormality in patients who have cardiovascular disease or diabetes, or if the patient has a family history of high cholesterol. The enzyme responsible for the breakdown of triglyceride is known as lipoprotein lipase, which is a target enzyme when attempting to lower triglycerides. The mode of action of Lovaza is not very well understood. However, potential mechanisms include inhibition of the DGAT1 and DGAT2, which are responsible for triglyceride synthesis. So when inhibiting these two enzymes, triglycerides are unable to form in the body. Some other potential mechanism of action include increase of lipoprotein lipase activity to promote triglyceride breakdown. Some pros of this medication include it has minor side effects when taken, and it can be used on top of other medications that the patient is already taking for high cholesterol, and they can take it on top of their healthy diet as well. Some cons of this medication include it is not a monotherapy. It's usually combined with another medication, and it can be costly. It could be over $100 per bottle. And lastly, the capsule itself is relatively large in size, so for patients who have difficulty swallowing large pills, this medication is not ideal for them. The capsule is available as a 1 gram liquid filled capsule. And for the dosage, for the treatment of hypertriglyceridemia, patients are to take 4 capsules by mouth daily, or they can split it in 2 times a day, 2 in the morning and 2 at night with a meal. As of right now, there are no need for renal adjustment in patients who have renal impairment as well as hepatic impairment. However, the safety and efficacy of the medication when used in pediatric patients are not well established. And lastly, pregnancy and lactation, the risk to the fetus cannot be ruled out. For the monitoring parameter, the patient should monitor the reduction in triglycerides, and they could do this by having their lipid panels measured often and frequently by their primary care provider. And for safety, the patient should look out for AST and ALT liver enzymes and check if they increase after taking the medication. And lastly, their LDL or bad cholesterol may increase over time, so the patient should also watch out for those levels. And here are a list of my references. Thank you for listening.